My name's Reena Ruparelia. I'm in Toronto, Ontario, Canada. You know, when I think about living in Canada and having coverage and then looking at the people that follow me that don't have the same experience, it makes me feel sad for them. It also makes me feel more compelled to take steps to raise awareness so that people are able to get the same care. I don't think just because I live somewhere that I should have different treatment than someone living in a different place. I think we should all have access to the same care so that we're able to get on with our lives and not base everything we do around psoriasis. I think the people living with psoriasis who are able to get access to treatment would be able to be much better functioning people in the world, be able to give more to the world, to their families, and to themselves. I first noticed psoriasis around the age of 14, and it was the summer before high school. So not what I wanted to see, and it started as small dots on my torso and my stomach. And when I went to the doctor, he said, "Don't worry, it's just chicken pox, it'll be gone." And that was my main concern, right? That I needed to get rid of these marks on my stomach. When I realized that this was a lifelong condition, it was an absolute heartbreak for me, because at that point I felt like my life was over, or the life that I knew was over, that I would be living with these spots all over my skin, and that for me translated into not being able to live my dreams, not being able to do the things that I want to do, to dream, to wear the clothes I wanted to wear. So it made me feel that my life was over. I remember being at work. I always think of the time putting on these plastic gloves, you know, with tons of like cream, just thick creams, and I couldn't bend my fingers, right? They would just split and they were really swollen and red. And I would wear these gloves just to kind of like type emails. And I wasn't aware, very odd, even though I was in so much pain, I wasn't aware of how much I was suffering. And it was this one day that I was kind of like, I took off the gloves and I was gripping the mouse. And I looked down at my hands and they were just shaking. And I just started to cry, and then I had a bit of a panic attack. I couldn't breathe. I called one of my coworkers into my office and I told her, "I can't do this anymore. Like, I'm in so much pain. I need help. Like, something has to change." I believe that I made peace with myself, my skin, and started to accept my psoriasis only 6 years ago. I've lived with the condition maybe for over 25 years. So when I had that moment happen at my workplace where I had the panic attack, I was bedridden. I stayed in bed for a few months, and I started to feed myself really nutritious food. I started to meditate regularly, started to drink more water, kind of cut out any of the triggers like alcohol, and a lot of like fried foods. I noticed that those things always flared me up, so I was paying more attention to how my skin was reacting. And I would say when I started journaling, I started writing about my condition, how I was feeling, and then starting a page on social media, on Instagram, about my private thoughts and my feelings, things that I was journaling about. I was like, I'm gonna put this out in the world. I don't want anyone to know that I'm doing this, but this is a way for me to release out into the world so that I don't have to hold it in my head and my heart anymore. If I didn't have the compassionate program, I feel that each injection would be $20,000 Canadian, something like that. Maybe that's complete, but it's thousands, tens and thousands of dollars annually. It's very expensive treatment. I wouldn't be able to afford it if I didn't have this compassionate program. And even with private healthcare plans here, if you have a pre-existing condition, it's not covered. So if I was to get my own if I was gonna get my own healthcare plan right now, the program wouldn't cover this psoriasis medication because I've had psoriasis before I was covered with the insurance program. When I think about how much I've spent on psoriasis over my life, I mean, minimum $100,000, minimum. A lot of money. Creams, everything I can find, treatments, naturopaths, all of those things came right out of my pocket. I believe that universal healthcare would have a huge impact on the world at large. When it comes to people living with psoriasis, I know many of us don't want to be sick. We don't want to be sad about our skin. We want to be out in the world, expressing ourselves, contributing to society, living the life that we dream of. So I believe that we could be functioning, happy members of society, giving back and serving in all different ways. So I always find it funny that I'm an influencer or that I'm, an advocate for this condition publicly, because I live so much of my life hidden. And my page was started in the same way. I was hidden, I was secret, I wasn't telling anyone I was doing this. And slowly, as I guess people started to find my page, because many people weren't doing it at that point, I guess people started to ask me questions. They started to kind of encourage me to feel better about myself, maybe put on shorts. So I started to challenge myself through these little challenges, or I started to share more about what I was trying and what I was using. And I think just listening to the community and watching it grow helped me build rapport and a relationship. And then it started to get the attention of certain media outlets. And then I remember being featured in a magazine and thinking, what? I can't believe this. So it kind of organically progressed. I never got into Instagram or onto Instagram to become an influencer or a person of, support. But as things organically kind of unfolded, I went from someone who needed support to now someone who provides hope and support. I like to call myself a hope dealer.